Hello everyone, and in this video we will learn more about cutaneous appendageal tumors. So what are cutaneous appendageal tumors? So they are tumors which are arising from pilosebaceous unit or the sweat glands, right? And the most important thing that you need to know about them is that most of them are benign, although rarely malignant forms are also found. And क्योंकि वो benign है इसलिए complete excision is curative, right? So इस डिजीज़ के डायग्नोसिस में प्रॉब्लम्स क्या आती हैं? तो द मोस्ट significant issue when dealing with cutaneous appendageal tumors is that when we do the histopathological examination, we often find that they have multiple lines of differentiation, right? And secondly, जो सबसे confusing चीज़ है हमारे लिए as students, that is एक ही ट्यूमर के मल्टीपल नाम होते हैं, राइट? तो वी डोंट रियली नो कि ऐसा क्यों है, बट इससे बहुत ज़्यादा कन्फ्यूजन हो जाती है, राइट? Now coming to the importance of knowing about cutaneous appendageal tumors, so the single most important reason for you to know about them is कि ये एग्जाम में पूछा जाता है, right? And apart from that, from a clinical point of view, the second most important reason is that they are markers of underlying malignancies at times. I mean, certain appendageal tumors are associated with some syndromes which often present with malignancy, and that is why you need to know about them. Okay, so as I said, most of them are benign, but rarely we do find malignant forms also. तो अगर कोई लीजन मैलिग्नेंट होगा तो what will be the features of malignancy? तो ये तो anybody can tell you the lesions will appear to be asymmetric, right? Then जब हम उसकी histopathological examination करेंगे तो they will have infiltrating margins. Then the cells, the arrangement of the cells that will be disordered or irregularly arranged cells, right? Then we will find features of cellular atypia, high NC ratio and etc. And of course we'll find a lot of mitotic activity, right? So these are the features based on which you can say that okay, this is a malignant form, but most of the times are benign only. Coming to the classification, तो अगर आप रुक्स डर्मेटोलॉजी खोल के देखोगे तो इट कंसिस्ट ऑफ अ लॉट ऑफ पेजेस एंड लॉट ऑफ ट्यूमर्स, एंड आई हैव लिस्टेड सम ऑफ दोज ट्यूमर्स, बट इसमें से सारे इक्वली इंपॉर्टेंट नहीं हैं. आई हैव ओनली टॉक्ड अबाउट सम इम्पॉर्टेंट वंस, राइट? सो वी आर ओनली गोइंग टू टॉक अबाउट ओनली अ स्मॉल सबसेट of pilosebaceous of tumors derived from the pilosebaceous unit and tumors arising from the sweat glands. Okay, so coming to the first tumor, that is poroma. Okay, so first we'll talk about the clinical features. तो ये most commonly adults में होता है, and it has no predilection for any particular gender. तो मेल एंड फीमेल में इक्वली कॉमन होता है. इट प्रेजेंट्स एज अ सॉलिटरी sessile skin color to red nodule. Most commonly it is found on the sole or the side of the feet, right? And क्योंकि वो weight bearing areas के पास involved है, तो जब भी उस पर trauma होता है, it tends to bleed. Okay, so it has some histological features जो थोड़े characteristic हैं, that you will find a tumor which is arising from the epidermis and then it grows into the dermis in the form of broad anastomosing bands, राइट? एंड जो सेल्स जो एपिडर्मिस में सिर्फ एक ही लेयर होती है सेल्स की विच इज़ केपेबल ऑफ प्रोलिफरेशन, एंड दैट इज़ द बेसल सेल, राइट? तो ये ट्यूमर्स भी बेसल सेल से ही अराइज करते हैं बेसिकली, एंड देयर मॉर्फोलॉजी इज सिमिलर टू द बेसल सेल. सो दे हैव अ बेसलॉइड सेल मॉर्फोलॉजी, राइट? एंड दे हैव अ कैरेक्टरिस्टिक फीचर्स ऑफ द स्ट्रोमा विच इज़ नोन एज अ पोरोमा स्ट्रोमा. अब इसका क्या मतलब होता है एग्जैक्टली पोरोमा स्ट्रोमा का, आई डोंट नो, पैथोलॉजिस्ट वुड नो बेटर, राइट? सो एंड इट ऑल्सो हैव the tumors also tend to have ductal structures. Okay, तो हिस्टोपैथ में दिखता कैसे है माइक्रोस्कोप में? So this is the epidermis and this is the dermis and this is the basal cell layer. Okay, so as I said, it tends to grow downwards in the form of broad anastomosing bands. ठीक है, मिडिल में एक बहुत ही डेंस स्ट्रोमा होता है विच इज लाइक दिस, राइट. So these are the broad anastomosing bands, and this is the characteristic stroma. And if we look at the cells, the lining of the cells, these cells are basiloid cell. They are similar to the basal cell. Okay, so I'm sorry, I meant poromastroma, not porostroma. Okay, so this is what it looks like under the microscope. Now coming to the next tumor, which is hydroadenoma. तो इसके हाइड्रोडेनोमा के क्या क्या क्लिनिकल फीचर्स होते हैं? तो मोस्ट कॉमनली इट इज़ फाउंड इन अ मिडिल एज और एल्डरली एज ग्रुप, एंड टिपिकली इट इज़ मोर कॉमन इन फीमेल्स, and it tends to present as a solitary, slow growing, firm nodule on the head and neck region. And sometimes the lesions may ulcerate, and in that case they present with oozing, bleeding and pain, right? So what are the histological features? So basically it's a dermal based tumor which may have solid or cystic regions, and it usually has two populations of cells. एक large polygonal clear cells होते हैं, and एक छोटे smaller cells होते हैं, right? So the clear cells, they are clear because their cytoplasm has a lot of glycogen, and that is what gives them the clear appearance, right? And they have a fibrovascular or hyalinized stroma, right? So this is what they look like. Okay, so it presents as a papule or nodule. Coming to the next tumor, which is hydroadenoma papilliferum. Okay, so it typically presents in a younger age group, younger to middle age female. It is classically almost always found in females, and it presents as a solitary or a small nodule in the anogenital region. Okay, most of the times the lesions are asymptomatic, but large lesions may rarely ulcerate also. Okay, so coming to the histological features, so it is a well circumscribed nodule which may be solid or cystic, and it has a lot of glands and papillary projections, and the epithelial lining of this tumor, of the nodules, it is double layered. It consists of a myoepithelial cell and a tall columnar cell. Okay, so let us see what it looks like. So as before, this is the epidermis, dermis. These are the tumor nodules, and it has a lot of papillary projections which are projecting into the nodule. A lot of papillae projecting inside. Right, and this is the cystic space, which is filled with fibrovascular stroma. Okay, and if we look at the cross section of these papillary projections, we'll find that it has two layers. It consists of a basal myoepithelial cell layer, and then there is a tall columnar cell. Okay, so coming to the next tumor, which is syringocystadenoma papilliferum. Now, coming to the clinical features, it is frequently congenital, and it is commonly associated with nevus sebaceous in up to 20% of the patients, and it is equally common in both males as well as females. And classically ये face and मतलब head and neck region में ज़्यादा common है, and classical presentation is a solitary nodule, and sometimes it may have a verrucous plaque-like appearance also. Okay, and the surface may be dry, or sometimes it may have a moist oozing surface also. So this is what it looks like. Coming to the histological features. So the epidermal surface is verrucous, and there are multiple epidermal invaginations which are extending into the dermis, right? And these invaginations may have cystic areas, and these areas are lined by papillae, which again is having a 2-cell layer thick lining. And the stroma, the fibrovascular stroma has a lot of plasma cell infiltration. ये क्वेश्चन पूछते हैं एग्जाम में frequently that प्लाज्मा सेल्स कौन से क्यूटेनियस एपेंडेजियल ट्यूमर में होते हैं. Okay, so let us see what it looks like. Right, so the dermis. Let me just draw this tumor. Okay, so एपिडर्मिस से नीचे डर्मिस की तरफ राइज करता है, एंड इट हैज़ अ लॉट ऑफ पैपिले. Okay, and cystic areas in the middle. So this is the papillary projection. Okay, and if we take a cross section of one of these papillae, we'll again find कि उसमें छोटी छोटी papillary projections और होती हैं. So it is like it has a lot of papillae, and अगर हम उसके cross section में देखें तो again छोटे छोटे projections inside that papilla, right? And the center is having a fibrovascular stroma which has a lot of plasma cells. Right, so, and the lining is, as I said before, it is 2-cell layer thick. So this is how it looks under the microscope. So coming to the next tumor, which is cylindroma. So what does it look like clinically? So it is usually found in the younger population, 10 to 30-year-old, and more frequently found in females. Okay, so it presents as a solitary nodule which is reddish to tan colored, and majority of the lesions, they occur in the head and neck region. Now most of the lesions are solitary, right, in majority of the patients, but if you find multiple lesions, that is found in Brooks-Pigler syndrome, which is a type of autosomal dominant disease, and it is caused by a chromosome 16q mutation, and it is associated with visceral malignancies. That is why we need to know that, okay, we need to identify cylindromas. For example, this patient is having 2 cylindromas, and so that might be indicative of an underlying Brooks-Pigler syndrome. Right? So what does it look like under the microscope? So typically it has well-defined nodules and islands of cells, and they have a classical appearance which is described as a jigsaw puzzle appearance. Okay, so this is what it looks like. So this is in the dermis, right? So multiple well-defined nodules, right? And there is some stroma in the middle, in between, scanty stroma in between, right? And so these are the well-defined nodules of the tumor, and this is the scanty stroma, and this is described as the jigsaw puzzle appearance. Okay, so this is what it looks like. So coming to the next tumor, which is pyridenoma. So clinical features. So again, it is common in the younger population, 10 to 30-year-old, and it has no gender predilection, so it is equally common in males as well as females. And usually it is a solitary lesion, and it is a painful nodule. Till now we haven't encountered any painful nodule, right? Rarely, if a lesion ulcerates, or if there is any trauma, so it may have bleeding and pain, right? But this is usually typically painful. Okay, and the most common region is the trunk and the upper limbs. This lesion is also spiroid adenoma is also associated with Brooks-Pigler syndrome. Okay, so coming to the histological features, so it presents like well-defined lobules or nodules in the dermis and in the subcutaneous tissue, and it has a highly vascular stroma. And many of the times we find a lot of hemorrhage and ischemic necrosis in that tumor. That is why it becomes painful. And the cells, the tumor has a lot of pass positive deposits of basement membrane throughout the tumor. Right, so this is what it appears like under the microscope. So as you can see, there is a lot of bleeding. These islands of blood of RBCs, right? So coming to the next tumor, which is the cutaneous mixed tumor. So this is usually found in the elderly age group, more commonly found in the male population, and classical presentation is that of a slow growing, painless, firm nodule. Most common region is on the head and neck region, right? And when we see the histology, so it's basically a dermal based tumor, so it's predominantly in the dermis, and it has a lot of nodules, and it is known as a cutaneous mixed tumor. And it is called as a mixed tumor because it has both epithelial as well as mesenchymal components. So epithelial cells, epithelial components could be in the form of cords, ducts, tubules, then squamous cell and mucin secreting cells, right? And the mesenchymal component can be in the form of you may find fibrous tissue, fatty tissue, cartilaginous tissue. So it's a mixture. That is why it's called as a cutaneous mixed tumor, because we find a lot of overlap, a lot of components. Okay, so coming to the next tumor, which is syringoma, right? So syringoma is actually quite common and commonly seen in the OPD. So it typically presents during the puberty in the younger adults in females, and classically it presents as multiple bilaterally symmetrical small papules around the eyelids or cheeks, and the papules are very small, 1 to 4 millimeters in size. And there is a variant which is known as eruptive syringoma, in which there is there is a successive crops of papules, and it is sometimes associated with Down syndrome. So this is what it looks like, right? And histologically, it is usually found in the upper dermis, superficial dermis, and there is no connection to the overlying epidermis. And there is the epithelial cells can be in the form of cords and ducts, and there are 2 layers of cells. But the question that is most commonly asked is that it has a classical tadpole tail appearance. Okay, so let's see what it looks like. So this is the epidermis and the dermis, right? So these are the nodules or ducts, whatever, and you will find this tail-like projections which are found on one end only. Okay, so these tail-like projection of cells, these are basically cells which are extending from one end of the island, and the center of these ducts, you find a lot of amorphous material, right? So these are the ducts, and these are the cells which are projecting from one end, and that is what gives this a tadpole tail appearance. Okay, so this is what it looks like. Oh, I'm sorry. So this is what it appears like under the microscope. coming to the next tumor, which is not exactly a tumor. It's defined as a hematoma in Rook's. So trichofolliculoma. So what is a hematoma? So it is an abnormal cell which is found in a normal location, right? So it's an abnormal cell found in the normal location. So typically it's a young male, and most commonly the head and neck region is involved. Presents as a single dome-shaped papule, and there is a central pore, and there is a tuft of hair which is projecting from that central pore, right? So this is what it looks like clinically. Coming to the histology, so there you find a single large hair follicle, and there are a lot of small hair follicles which are arising from the wall of the parent follicle, and there are a lot of hair which are protruding from that, and this is described as a parent and baby appearance. Okay, so it looks something like this. So this is a dilated pore and a parent follicle, and we have a lot of small hair follicles which are arising from within that parent. Okay, and you may find hair which are arising from these baby follicles. Okay, so this is the parent pilosebaceous unit, and this is the baby pilosebaceous unit. Okay, so this is what it looks like. Okay, so coming to the next tumor, which again is hematoma, trichoepithelioma. So the previous one was trichofolliculoma. This is trichoepithelioma. This is also a hematoma, and it classically presents in a young female. It presents as a skin-colored papule, especially on the face, and especially along the nasolabial fold. And most of the times it is a solitary lesion, but if you find that if you find multiple lesions, then they are found in certain syndromes, right? Like Brooks-Spiegler syndrome, Rombo syndrome, and multiple familial trichoepithelioma, all of which are autosomal dominant. So coming to the histological features, so it is basically a dermal neoplasm, and it may or may not be attached to the epidermis, and there is a nests of cells which are basophilic, and they are surrounding us, and in the center there is some eosinophilic material, and then we have fibrous stroma and all. So let us see what it looks like. Okay, so this is the epidermis, dermis, and this is the nodule, right? This is the, and it has that nodule has a lot of small islands. So the nodules are well defined, and these are this is the eosinophilic material in the center, and this is surrounded by a layer of basophilic cells, and this is the stroma. So these are the basophilic cells. So I guess I will have to make them basophilic. Okay, so basophilic cells. So coming to the next tumor, which is tricholemoma. So it is more common in the younger or in the middle-aged population. It has no gender predilection, so equally common in males and females, and classically involves the head and neck and the face region. And it is usually a solitary small skin-colored papule, and the surface is usually smooth but could be warty as well. And if you find multiple lesions of tricholemoma, that is associated with the Cowden's syndrome or Cowden's disease. So that is important to know. So from a histological point of view, it is a well-defined tumor, and it extends down from the epidermis, and the tumor cells, they tend to have a clear cytoplasm, and that is because there is a lot of glycogen inside, and they have a very low mitotic index. So, and no ducts are formed, right? So coming to the last topic, which is which is a group of sebaceous gland tumors, right? So there are four closely related topics, and I will discuss them together. So there is sebaceous hyperplasia, sebaceous adenoma, sebaceoma, and sebaceous carcinoma, right? So let us see. So all four have some common features, right? So they are basically abnormalities of the pilosebaceous unit. They are more common in the elderly population, classically on the head and neck region, right? And they are associated with Muir-Torre syndrome, and that has some internal malignancies also. So we need to look actively for that. And the basic histopath in all the four is that of a typical pilosebaceous unit, right? The only difference being that there is a progressively increasing cellular atypia, right? And second point is that there is a progressive increase in the thickness of the germinative cell layer. Okay, so it is least in the sebaceous hyperplasia stage and maximum in the sebaceous carcinoma stage, right? So you can think of it like a spectrum. And if we talk about the malignant potential, sebaceous hyperplasia has the least, followed by adenoma, followed by sebaceoma, and then carcinoma. That is already malignant. Okay. So let us see the differences. Okay. So sebaceous hyperplasia has just a single layer of germinative cells, right? Sebaceous adenoma, as you can see, that has many layers, but those layers are less than 50% of the lobule. Okay, sebaceoma has more than 50%. So the germinative cells, they constitute more than 50% of the lobule, but there is no cellular atypia. Okay, and the only differentiating factor between sebaceoma and sebaceous carcinoma is that the germinative cells are more than 50% and with atypia, right? So in terms of the thickness of the germinative cells, this is how the different diseases progress. Okay, so I hope that is clear. I hope you liked it. Thanks for watching.